Good afternoon, everyone from Los Angeles. I want to welcome you. My name is Dr. Heitham Hassoun. I probably know most on the call, but we have invited those who want to attend our session on healthcare diplomacy from outside of Cedars-Sinai. And this is very, very exciting, super excited. We have an all-star cast and a special guest, Ambassador Marcela Solorio, as well as Dr. Jorge Goldberg is joining us on the panel on behalf of Dr. Jerry Green and Art Ochoa, my colleagues in sort of masterminding this healthcare diplomacy concept. This is our second session. We have done one, which was mostly, was only an internal Cedars-Sinai event, looking at U.S.-China relations. And of course, we immediately wanted to move on to U.S.-Mexico relations. It's so important to, especially to us in Los Angeles, but really everywhere in the country and around the world. And you know, I think the concept of healthcare diplomacy, you know, I'm passionate about global collaborations in healthcare. This is what steered my career from being a surgeon to getting into international business. We take care of patients that come to us with needs, and Dr. Jorge Goldberg is going to give us a little taste of what Cedars-Sinai has been doing as it relates to taking care of the needy who come to us from Mexico. But I'm also intensely passionate about developing sort of organized collaborations in healthcare. It's a little different than the public health space, but all of these things merge together. And most importantly, what we who are entrenched in hospitals and doctors and such forget about really the importance of policymakers, the economics around countries and their relationships. And so this healthcare diplomacy is a part of our educational series that aims to address this. And it's a little bit different than what you might get usually in the public health domain. But nonetheless, we're really excited about it. So today, we're going to have a few little kind of sessions, if you will, or sub-sessions of the hour. First, I'm going to ask Dr. Jorge Goldberg to give a little flavor, as I mentioned, of sort of Cedars-Sinai and Mexico relations. And then I'll pass it off to my colleagues, Dr. Jerry Green and Art Ochoa, who are going to speak a little more specifically around the concept of U.S.-Mexico relations, and then introduce a main event, which would be a fireside chat type of question and answer session between Jerry and the ambassador, Marcela. And of course, we will save time, and I'll do my best to kind of coordinate some questions from the audience via the chat and Q&A box. And with that in mind, Jorge, the floor is yours to tell the world about the great things you're doing on behalf of Cedars and we're doing between Mexico and Cedars-Sinai.
Hi, thank you, Heitham. It is a pleasure sharing this webinar with you. I do have very short time, but I want to briefly share with you what we have done with the Mexico office experience with Cedars-Sinai International. We officially opened our office in 2004 in Clínica Lomas Altas in Mexico City. Our first project as part of Cedars-Sinai International was a telemedicine unit. We did start with academic forums, second opinions, consultations with Cedars-Sinai physicians, and talks and ground rounds for residents and physicians of our local hospitals. At that time, we did not know that telemedicine would evolve to what we have today, and it's probably the future or part of the future of medicine with what's going on in the world. In the academic arena, over more than 16 years, we did several symposiums with topics ranging from cardiology to women's health to live endoscopy meetings, always with experts from Cedars-Sinai that came to Mexico and would bring their expertise to us, physicians and patients. We also did approach several communities and did sign agreements with them, mainly the Jewish and Lebanese community, and we worked very close with them in areas of healthcare prevention and patient referrals. we've done a lot of work in the area of patient referrals to physicians at Cedars-Sinai. What we do is we identify cases in Mexico that do need expert care. And then we contact our office in Los Angeles, and we do a lot of what we call personalized medicine for that patient. And we do find the expert at Cedars-Sinai. Then we send all the information, that is the CDs, MRIs, clinical information, always in contact with the local physician. Once we identify the proper physician at Cedars, all the appointments are made, and then we refer the patients for expert care at Cedars-Sinai, Los Angeles. We've been very lucky that many of the things that can be done in Los Angeles, we cannot still do them in Mexico or LATAM, but thanks to the cooperation, we're evolving and learning from them. We also help our community with health fairs, and we do publish a lot of articles in magazines and social media. But we always focus on improving healthcare quality in Mexico. So it's a bilateral relationship. Obviously, Ambassador will talk more about it, but it's always, we try to learn from physicians there, but our local physicians and patients get a lot from our relationship with Cedars-Sinai International. Obviously, this year of the pandemic, we had several webinars and social media posts that have been very helpful for patients and physicians in Mexico. We always try to educate the people and to improve and prevent their health and well-being for our patients. We also work with local hospitals, private hospitals, in having agreements so we can exchange the expertise from Cedars-Sinai to our local hospitals. And now, under the leadership of Dr. Heitham, we are expanding our efforts to the whole of Mexico country and Latin America. And we have new allies like the Mexican ambassador in LA that's going to be very helpful in the future. I am sure that we will continue our strong relationship between Cedars-Sinai International and Mexico and bring their expertise to us, always with the priority of the well-being of our patients and community. And it was a brief report of what we've been doing over the past 16 years, and certainly over the past year that's been very active. And I want to thank you, everybody, and I'm very eager to listen what we're gonna hear from the ambassador, Dr. Green, and Arthur Ochoa, and Dr. Heitham. Thank you very much.
Thank you, Dr. Goldberg. Very nice summary. So I'll pass it on to Art and Jerry. I think that Jerry at the helm of the Pacific Council is so helpful, and for me, I benefit so much from this relationship, and they'll speak more to it and take us into the next part of the session.
Thanks, Heitham. And I realize that I'm sort of standing between all of our program participants in the main event. So I'm going to try to be brief in my comments, and I principally want to introduce Jerry Green. I have the privilege of serving on the board of the Pacific Council and working with Jerry in that capacity. But before I turn to that, I just want to say, how delighted I am that we're having this conversation today. And Heitham, thank you for organizing it. Mexico is so important to the U.S., to the region, to Los Angeles, to Cedars-Sinai. Obviously, we share a border, we share a history, we share a culture. Mexico is a critical trade partner. Jerry is often fond of reminding me that Mexico City is closer to Los Angeles than Washington D.C. And of course, in Los Angeles in particular, not only are there many Mexican nationals, but there are many Mexican Americans, and I am one of them. And so this today's conversation is meaningful on so many levels. Let me introduce Jerry. Jerry is the president and CEO of the Pacific Council, on international policy. He's also a research professor at the University of Southern California, Annenberg School of Communications and Journalism. Previously, Jerry's been a partner at a global merchant banking firm, occupied a number of senior positions at the RAND Corporation. And prior to that, he had a career as a tenured academic at a number of the nation's most prestigious universities. He himself is you will hear his Boston accent in a moment. He hasn't shaken it. He is a grad of UMass Boston and has a master's and PhD in political science from the University of Chicago. He has lived and worked in Egypt as a Fulbright fellow. He's been in Iran and Israel. He has lectured on 6 continents, but that's only because Antarctica does not have an academic institution with which Jerry could visit. He's led 3 U.S. Department of Defense delegations, sponsored by the Pacific Council, connected the Pacific Council around the world, and numerous Pacific Council led and sponsored delegations, including to Mexico. He's a member of the Council on Foreign Relations and a number of other institutions. I will just say 2 other things about Jerry because we could spend a long time just introducing him. He is a member of the advisory board of the Bill Richardson Center for Diplomacy, an FBI hostage recovery fusion cell influencers group. And on top of that, my favorite cocktail party conversation point related to Jerry is he has been a longtime technical advisor to Activision Publishing in Santa Monica, California, where he consults on the highly successful Call of Duty series, if you happen to be a gamer. So with that, I give you Dr. Jerry Green, the president and CEO of the Pacific Council on International Policy.
Well, thank you, Art, and thank you, Heitham, and thank you, Jorge. And I want to welcome our very distinguished guest, Ambassador Marcelo Solorio. I want to say a drop about U.S. Mexican, but specifically California Mexican, and more specifically Southern Californian Mexican relations to put this in context. Legally and technically, Mexico is a different country than the United States. Having said that, in terms of human geography and other matters that affect every day of our lives, we may be 2 countries, we are 1 region. So if you live in Southern California, you are not perhaps legally Mexican, but there is a Mexican-ness that is part of your daily existence, which is one of the great reasons for living here. And I say this, I'm from, as Art said, I'm from Massachusetts. I don't speak Spanish. I speak French because that's what they taught us in high school in Boston and so forth. But it's come to me that I've lived most of my adult life 100 miles within the border of Mexico, both in Los Angeles, in Tucson, Arizona, and in Dallas, Texas. And it is impossible to think about Mexico the way we think about other countries. The Mexico relationship between Southern California, relationship with California and Southern California, it is unique and it is special, it's distinctive. And Art is right, we are closer to Mexico City than we are to Washington. But in addition to that, Mexico as a country certainly recognizes this. Ambassador Marcelo Solorio Mancera has had a uniquely distinguished career within her the foreign ministry. She has 2 master's degrees. She is a trained attorney. She has ambassadorial rank, which is rare for consuls general. Usually a consul general is a consul general. Sometimes with really important diplomatic postings, the consul general is herself or himself an ambassador. The Mexican consulate in Los Angeles is not only the largest Mexican consulate in the world, it's arguably the largest consulate in the world. I don't think there is any American consulate around the world that's as large as the Mexican consulate in LA. And Mexico has consulates all over the state of California. I don't, the ambassador will tell us how many, but there is a major, major Mexican diplomatic presence here. Through her career at the ministry, she was the National Director of Naturalization, which promoted and encouraged the recognition of dual nationality. This is something well known to Israeli Americans, to a number of nationalities, and that's the case as well for Mexico. So there are lots of people that are both at once Mexican citizens and U.S. citizens, which I regard as a net positive for both countries. She was subsequently the head of politics. She was the politics protection director, which oversees the mechanisms of border cooperation between the U.S. and Mexico. And again, most Americans don't, they sort of think about the border, which is where the two countries meet. But in fact, Mexico is we need to think about Oaxaca just as well as thinking about, Brownsville or places on the border. This is a very, very big country, but the border areas are really important. And finally, she became head of the U.S., the United States division at the Ministry of Foreign Affairs. So she's one of her country's leading experts on the United States. She's a seasoned diplomat. She was the chief of mission in Tel Aviv. So, I'm always wishing her Shana Tova, or, whatever it is, depending upon the time of year. She was at the Mexican embassy in Brussels with responsibilities for the European Union as well. She was the deputy consul general in New York. She was the consul general in San Diego, and now the jewel of the crown, and I really mean this, of the Mexican Foreign Ministry, the consulate general in Los Angeles. But I would encourage everybody on the call to remember that our relationship with Mexico is distinctive, it is special, and in a sense, since we share a region, we really are not, sort of strangers interacting. We're actually, the same people sort of dealing with different aspects of the problem. Final point, and then I'm going to begin, I'm going to let the ambassador speak. I've got a bunch of questions for her, is health diplomacy has been given new life, unfortunately, as a consequence of a global pandemic. When people talk about building walls between countries, and the wall between the US and Mexico was a profoundly bad idea in my view. We certainly need a border. We don't need a wall. We actually need bridges. Germs and disease and viruses don't recognize walls. When we are in a fight against a pandemic with, something that began in Wuhan and made its way to the United States, we in China are on the same side. We're not on opposite sides. We are the same species. Dr. Goldberg or Dr. Hassoun will be able to treat patients irrespective of their nationality or their passport. So the whole notion of health diplomacy is really important. And it's uniquely and especially important in terms of Mexico on two levels. A, public health, which are, affecting large numbers of large populations, but also individual health. And Dr. Goldberg was making reference to pieces of both of it. So I really want to welcome Ambassador Marcela Solorio. She may want to say a few words. I've got some questions, and then we will open it up. But I'm really so grateful to you for doing this for us, and thank you for all you do in Los Angeles and promoting close ties to a country with whom we share a huge region and much, much more.
Thank you so much, Dr. Green, for your kind words and introduction. And it's very nice to be here with you all. I am very, convinced that for us diplomats as facilitators and connectors, it's very important to participate in this kind of initiatives. And as Dr. Green mentioned, now the healthcare diplomacy facing a pandemic is like even more evident to us. So just to leave you there and then wait for the questions. I think that in troubling times, in challenging times, either domestic or international relations, it's better to have institutions and rules that not have at all. So we will elaborate on that, but I think that is very important to know where we're standing. So that gives us a little bit of certainty in an, challenging times, such as the one that we're facing. Thank you so much.
Thank you. And let me begin by asking you a couple of questions. The vaccination imperative does not end at the border. It does not end at the border. It is imperative that there is a vibrant vaccination program that encompasses both countries. And I'm curious, is there any formal collaboration between our governments in terms of in terms of acquisition of vaccines and developing policies for vaccination? Because we don't want to close the border. A, that doesn't keep disease at bay, and B, it's very deleterious to both of our countries. So I'm curious if there are binational agreements that sort of address these public health challenges.
Yes, well, as you know, Mexican government nowadays, the most important thing is to provide to the public the access of the vaccines, not to the private sector. But we have, as I mentioned, these institutions and rules, and I want to mention specifically the USMCA, that is an avant-garde treaty that provides us with the regional framework that will help us to continue to reactivate the economy in the middle of this pandemic. So, of course, vaccines will help to reactivate the value of chains of that our economies demand, and we want to assure the trade flow within the region. I know that there's not a specific chapter for healthcare industry, but as I mentioned, there are a lot of areas that we can explore with the USMCA. Now I am thinking we have to understand what is the position of the government that they want. They already assure certain types of vaccine or the origin, different origin from China, from the United States. So now we have to understand what's the set of mind that they want to just send it to the public population. But I think that there will be opportunities for the private sector to engage in this endeavor. And that's why we're here today with Cedars-Sinai, that to explore ways how they can support these governmental efforts. Because I don't think that is the beginning, just the beginning, and it's not that they're shutting the door. But if we can come with the creative initiatives and ideas and support in the way that they can give us this path to provide in the private sector, through the private sector to the population, the vaccines, that will be great.
In the United States, you and specifically California, you are a celebrity of sorts. In I don't mean that in the movie star sense, but a senior government official for the government of Mexico, is an ambassador, a consul general for a very, very large population in California. You have an incredible degree of influence, which, in my experience, you've used for very good purposes. Is there any sense that there are cultural concerns about being vaccinated, that people don't want to get vaccinated? Is there a way in which, since we're trying to promote vaccination, that we might work with you, because people might listen to you, in ways that they might not listen to us, because we just don't have that same degree of connectivity?
Of course. I am very happy to be in a panel with Dr. Green, because he always says a lot of good, nice things to me. And, facing a pandemic, this is, lifting me up. So thank you, David. Yes, that's a challenge. Just today I had an interview and they were asking me, you have all these vaccines but they have been, the trials have been using just Anglo-Saxon volunteers, and they're not have been tested in Latinos. So what is going to happen to us? So we are afraid. And I said, wait, we have to rely in science. We have to rely on the experts. That's why you're here today. I'm not an expert, but I have a confidence in you. And I said, I have been reading some essays and I have information that tell us that it doesn't matter the race or ethnicity, you're Afro-American or you're Latino or Hispanic or Anglo, the DNA acts the same way. So it doesn't matter if you get a vaccine. On the contrary, you're gonna save your life. And I'm gonna lead by example. So as soon as I am able to have the vaccine, I'm gonna put it on and show my community that their consul is doing it, because it's the good thing to do.
What we really need are public service announcements in Spanish.
Yes.
That you would do perhaps with Dr. Goldberg, who's sitting in Mexico City, simply telling people, because the mortality, the morbidity rate, I don't want to pretend to sound like a doctor, I'm not a real doctor, I'm just a PhD, but if the statistics about morbidity amongst minority communities and communities of color are much higher, and so there certainly are likely to be uncertainties, and this is a very tangible way that we might be able to work together. A related question, if I may, is the consequences of being locked down, of quarantine, of going to work every day and putting one's life at risk, which for many people is severe. And I often wonder about the mental health capabilities. What mental health resources, what counseling resources are available to let people know that in fact they're not alone, that there is a light at the end of the tunnel, and all of the related issues, because this affects families. Their children, can't go to school, or they're being educated online. I mean, the consequences of this are profound, and we are talking about large numbers of our own citizens and residents.
Well, that's a very concerning issue, because during this pandemic we just not provide citizen services, but also humanitarian services. We provide with food packages to almost 2 million people because we have wonderful allies. We have a COVID-19 center here at the consulate that provides this testing to the whole Angelino community on free. And we also have a health office that addresses not just the physical health, but also mental health. And that will be very useful if we can, strengthen this office with you all. Because something that we saw is domestic violence on the rise. And that's very sad, really. We are lucky. We're lucky that we're here and we are be able to have a conversation, and we're lucky that we're be able to help. But for all these people that in a normal situation, they were facing domestic violence, imagine within a pandemic, and now with these health issues increasing, that's like the worst nightmare.
Let me ask you, we have a new presidential administration coming to office. I don't want to be political, but I would look like I was being irresponsible if I didn't, acknowledge a profound change. The Biden administration is being advised by Roberta Jacobson, for example, who was our former very successful ambassador to Mexico. They have a different orientation to Mexico, and so forth. What are the sort of top, 2, 3, 4 issues that should define U.S.-Mexican relations more broadly as the Biden administration assumes office?
I think that is very important that we keep in mind that with this new administration, there will be more important efforts in human rights, in migration, in labor protection and labor rights. And of course, I am very happy that we already have signed USMCA, as I said, because that will provide us a framework of certainty, and that's what we're aiming for. So I think that's always it's a new opportunity, always representing my country, no matter who is in the White House. I've been able to work with the Democrats, with Republicans. Of course, I'm very happy that Roberta Jacobson, will make a comeback, hopefully. She's wonderful. So, and here in California, with all the help that we have receiving the Mexican community from the governor, from the mayor, and with this alliance that we have now, or we're starting with Cedars, I hope that we'll be able to be so aware in the health area, all the opportunities that we have.
What are your biggest challenges in again, I almost, I would make 2 suggestions if we could all go out. One would be a visit to the consulate, which most people don't visit unless they have business there. The enormity of the consulate, the size, the number of people you have there, the issues that you deal with are remarkable and worth visiting. And then the other visit I'd suggest is to the border, which I've done on both sides. And one of the things that's so astounding, surprising to Americans, that to be candid, on the Mexican side of the border, they are, it's sort of better funded and better organized for human capital issues than on the American side of the border, which I never would have guessed. Americans always think we're the best and So in terms of your responsibilities, what's your biggest challenge? What's your biggest headache? Is there anything that we can do? I always say by helping you, we're helping ourselves. So this is not altruism. It's just being really, really smart. Is there anything that we could do to sort of strengthen this relationship as Angelinos?
Well, I think that for us it's very important information and education of the community. As you mentioned before, the vaccines, there are a lot of people that say, I'm not gonna have the vaccine. So the idea of this PSA is a wonderful one. And I think that it will be very helpful for the consulate if you take me into consideration, if you want to convey a message, to inform, to provide this education to the community, that will be fantastic.
Good. Well, that's something, plus we have a mayor who speaks Spanish fluently and takes great satisfaction in his Spanish language abilities. There are ways to do this, and it helps us. This is not our helping, maybe if we send foreign aid to Mongolia or something, that's different. Anything that we do in Mexico helps us in the United States and vice versa. I'm happy to keep going. Do we have questions from the floor? Should I wait? Should I, sorry to.
I think that I would turn to Heitham for who's I think managing.
You guys are so just so you know, you're very educational and insightful and immensely entertaining, and I'm sure all the attendees are enjoying. I do want to put a reminder to everyone that don't be shy to pop in questions into the Q&A session as you think of them. we'll do maybe a little bit more and then take some time out for, questions from the audience, questions from the panelists, and we'll keep the discussion. There's so many things to talk about, but please don't hesitate. Just fire away.
I'll turn it back to Jerry, but maybe Jerry, you and the ambassador could spend a minute. I'm sort of interested in knowing a little bit more to the extent the ambassador is in a position to share about Mexico's longer term plans in the healthcare biotech space. Anyway, I'll turn that back to you, Jerry.
That's the question. Madam Ambassador, what can you tell us about Mexico's involvement in biotech and things of that nature?
Well, what I can share with you is some facts that we have regarding medical tourism. I think that it is a broader information, but I think that will be useful. For example, in just 10 years, Mexico's foreign income for medical tourism has tripled. Mexico has over 220 General Health Council certified hospitals and numerous smaller clinics licensed by the Pan American Health Organization. The growth of medical tourism industry in recent years is due to several factors, such as geographical locations, the one you were saying, cross-border, we are 100 miles to the border with Mexico, connectivity. Now, medical tourism is defined by international travelers in order to receive medical services. It involves consultation, intervention, hospitalization, clinical care, provision of medications. According to information from the Medical Tourism Association, surgeries and medical treatments in Mexico and specialties such as cardiology, cosmetic surgery, ophthalmology, oncology, and dentistry, among others, are between 40 to 80% less expensive than in US. 80% of the tourists who travel to Mexico for health reasons come from the US, mainly from California, Arizona, and Texas. The most popular destinations for medical tourism are Yucatan, Sonora, Nuevo León, Jalisco, Quintana Roo, San Luis Potosí, Baja California, Chihuahua, Tamaulipas, Mexico City, and Puebla. So I think that all these show you that there's a booming industry in Mexico. And to your question, it will be great if we can evolve, with biotech that will contribute to keep on with the world movement in this area. So there's a vast fields of opportunities.
We have a question actually from someone in our audience. We've made reference to USMCA a couple of times, and someone was asking, what is MCA? If you would talk a little bit about it and how it differs from NAFTA, that would be very helpful.
Oh, I am so sorry. We diplomats, and I think that in every field we tend to use acronyms, and the people say like, what's that? Well, USMCA is the US-Mexico-Canada trade agreement. In Spanish is the TEMEC, Tratado de México, Estados Unidos y Canadá en Libre Comercio. We used to have, this is the one that substituted NAFTA. NAFTA was the North American Free Trade Agreement that was signed more than 25 years ago. And that was to serve as a framework for our trade and investment relations. And I am very happy to say that with USMCA is an avant-garde treaty, because it has to do with e-commerce that the previous one didn't have. And for example, now have, and I have to say that because I'm a woman, the gender perspective that, for example, none other free trade agreement has that. So we should be very proud that in North America, we're having this approach, the gender approach. But as I mentioned at the beginning, I think that it doesn't matter who is in power, or if in Mexico is, and as I said here, a Democrat or Republican, or in Mexico is a leftist or a rightist or a moderate. You are going to have a set of rules and a set of institutions that will give you this certainty, because I think that more, now more than ever, the pandemic tell us, because we are human beings, are, we have short memory, but this reminds us that we need international cooperation, that we're not going anywhere even we're not using international cooperation. That's why this is very important. Dr. Jorge Goldberg in Mexico, you guys here in the States, and we're talking about this, and we are assisting in our role of connectors and facilitators. So we have to make the best of it.
Dr. Goldberg and Dr. Hassoun, if you have comments or questions, please.
I want to pick back up on the medical travel concept, Ambassador, and really Jorge and the whole panel to dive a little deeper into this. So I think there's definitely a two-way flow of traffic, if you will, or patients seeking care, predominantly going from the US to Mexico for cost savings or to access healthcare at a reduced cost, whether it's coming out of pocket or whether the insurance is steering them or what have you. I think certainly, as Dr. Goldberg mentioned, most of the patients coming from Mexico to seek care at Cedars or other similar hospitals are doing so most of the time because it's complex. There may be access to certain type of high tech or high touch care that they would get at a complex academic medical center. If you look at the insurance, private sector insurance and healthcare, North America is the behemoth. So nowhere else compares in size and volume. Where they might compare in Asia and in parts of Latin America when I speak more to South America is the growth rates of the private insurance scheme. And most of our patients that come are coming with insurance. We don't get a lot of cash paying or self-pay patients like we would from Asia, and it's because of the development of the sector. So as I spin this kind of into a question, I feel like more can be done to nudge or promote healthcare in Mexico as a country to become more cross-border, if you understand what I mean. What can the government do? So when I go out there in places like, that are really seeking patients to come in, Turkey, Korea, South Korea, many of Malaysia, Thailand, the government is very, very, very active in facilitating the industry and making it. And so I wonder if you have thoughts in mind of some things that the Mexican government can do to attract U.S. companies, whether insurance or hospitals like us, but even more importantly to me, in a selfish way, to attract some of those top private hospitals to collaborate and to do joint efforts to bring those highest tech, high touch, personalized care to the local population in Mexico. Not from a public health, but from really talking about best in class care.
Yes, I'm going to talk a little bit about my experience at the border. I used to be the consul in San Diego. And for me, since the day I arrived there, for me, it was very clear that I was not just serving in San Diego to the Mexican community, but I was a cross-border consul. And then that's why I created this cross-border diplomacy, because I recognize that there's a profound binational population that needed attention and that needed answers. It is very easy for people in Washington, D.C. or in Mexico City, and I say that is very easy because I used to be posted in Mexico City and I used to be posted in Washington, D.C., that from a desk, you can, design public policies, and you can solve all the problems that we have. But it's very important to have boots on the ground. And once you have boots on the ground, then you can identify ways to solve these problems. And I'm going to pick up on this suggestion that I was going to say, Jerry, Dr. Green mentioned, is that with this consular network that Mexico has in the United States, 50 consulates, and we have 10 along the border, almost 12, and 10 in California, you should take advantage of that, and maybe we can do an alliance so we can bring people, maybe not just to the border, to Baja California, but all these states that I mentioned, once the pandemic allow us and leave us alone, we can go and so the people can get to know. And for me, the most important thing is to build confidence. And confidence goes both ways. Mexicans for Americans and Americans with Mexicans. I think that's very important, to build confidence, to really get to know the place, not just imagine what are their needs. So really identify what are they needing. And we're here to facilitate and be connectors to all these people.
Yeah, I certainly think accreditation, so quality standards and accreditation and internationalizing sort of standards of healthcare is very important. And I think that's kind of what you're referring to. And Jorge, would you have any, you must have some thoughts on this topic.
Yeah, number one, Ambassador talks from the governmental side. Ourselves speak about the private hospitals in Mexico that are very important because they are more sophisticated in certain areas. But certainly what we're trying to achieve, Ambassador, through Cedars-Sinai International is those cooperation agreements. And we've been doing that in the academic area by bringing physicians from Cedars and bring their expertise and teach that expertise to our physicians in Mexico so we can start doing some of those sophisticated procedures. But I guess now under this new global idea that Cedars-Sinai International has is to bring collaboration agreements so we can, I'm talking now about Cedars-Sinai, we can help our local hospitals with different areas. And we go not only physicians, we've discussed with some of the private hospitals in Mexico, nurses and other areas of expertise that Cedars can bring to our local private hospitals. Hopefully, ideally, with your help, we can do that in the government hospitals in the future. But so far we're doing with the private hospitals. And I do believe that will help this cross-border, because we've been to Tijuana to try to do this in some of the hospitals. And I guess there's a lot of room to improve that collaboration.
I'm going to give two quick examples, if I may, and then we've got another question. They're both San Diego examples, but they're interesting. One is there is an airport on the Mexican side of the border where people from San Diego can basically cross a bridge and catch a flight from the Mexican side of the border, and the service to certain places is great. The prices are competitive, and it's made the border, almost irrelevant because it's really very, very easy to take these flights. The second example is I visited a lot of factories on the maquiladora factories on the Mexican side of the border, and I visited one that was given a prize by the U.S. Department of State for being, such a spectacular business. And they make valves for heart, that are, I'm not going to get this right. It shouldn't say this to a bunch of doctors, but it's some, medical device that is implanted into people's hearts in order to, increase their longevity. And it's a very sensitive manufacturing process. and it was given an award by our State Department, and the factory is in Mexico. So the ambassador was talking about ways that sort of blend the border not being a demarcation, but it's as I was saying earlier, she said it better than I do. It's the same area, but there's something, where the legal border is. And these are enormously promising, both the airport and the maquiladoras. I've got a question. I'm not sure. It could be for Dr. Goldberg, Dr. Hassoun, Ambassador Solorio, and it's from Gina Smith Woods. And the question is, what area or region of population is currently most impacted with COVID-19? And I'm not sure if she's asking about Mexico or the US. So, you can all field this one. Will these areas be provided the vaccine first, which again is well above my pay grade? And also from Lydia Jimenez, hi, Dr. Goldberg. So I want to make sure, Dr. Goldberg, that you get greetings from Lydia Jimenez.
Let me tell you briefly what's going on with the vaccine in Mexico, and that may help the ambassador to give information to the Angelinos. For legal reasons, anything that comes to Mexico has to go to COFEPRIS. That's the institution in Mexico that regulates medications. And they have the vaccine now. As you mentioned, they have several vaccines, the one from China, from Russia, from the US, from Europe. And they're doing phase 3 in Mexican population to see if they have different side effects to those that have been reported. So yes, there will be information about the vaccine in Mexicans with this phase 3 trial. By the end of the trial, the COFEPRIS will say if it's safe or not to use the vaccine. Very likely it will be safe. The idea that the Mexican government has is to give the vaccine first to first responders, the same as in the US, physicians, people working in the hospitals, and elderly population, because it has been shown that there's higher mortality in those specific groups. Ideally, everybody should get the vaccine, but very likely it will start with those groups. And at least in Mexico, what we hear from the government is the government will distribute the vaccine. You will not be able to go and buy it in a pharmacy or a physician office at the beginning. So we're going to have to wait for the government to decide who gets it first. Very likely physicians, first responders, nurses, and whatnot, and elderly people in nursing homes and so forth. So very soon we'll have the answer that the vaccine is safe for the subgroup of Mexicans. But I do agree, we are all humans and we should respond the same way.
Dr. Goldberg, a bit more from Lydia Jimenez. I'll be very quick, but she's the nurse case manager for the complex care coordination team at Cedars. She trained at the ABC hospital in Mexico City. She knew you when you were training in Baltimore, and she would be very interested in connecting with nurses in Mexico. And the reason I'm kind of eager to make this point is any people at Cedars who, speak Spanish, who are interested in meeting colleagues in Mexico, who, like Nurse Jimenez are, really, sort of have experience in both places. I say we, should be supported. I'm not much of the we here, but it's so interesting. There's so many of these cross-border relationships. And again, it makes the ambassador's point and my point, I think very eloquently, that we're talking about, different legal entities that are otherwise very much the same. And I think it's important. So thank you, Nurse Jimenez, and thank you for all you do as a nurse case manager.
Yeah, I will contact her and for her to know that we are currently in talks with the ABC hospital to do something with our nurses and their nurses. So I guess we are on the right track. But yes, we're working with the ABC as we speak.
Great. Ambassador Solorio, if I may ask, we're running close to our time. So what I'd like to ask, if you have any final thoughts, any suggestions, something that I feel somewhat like I'm sort of a messenger here because of this very special relationship with Mexico. So what is it that our colleague and people on the call, not only on the webinar, not only from Cedars, but also Pacific Council members, where you have a big fan group and others. So what in this very difficult time, with a light at the end of the tunnel, any parting thoughts or suggestions for us?
Well, that's a big task. The only thing that I can say that I am very grateful that we have this conversation, because as Dr. Goldberg mentioned, you're representing the private sector and I am in the government. But I think that, and I want to stress that, and I'm going to repeat it again. I don't want to say that blunt, but you have to use me. I'm a facilitator. I am a connector. I am here representing my country. And I think you are the experts, and you have built confidence along the way. So, sorry, something happened here. So I think that we have to join forces. We have to do something. And we're very creative here. The PSA announcement, the visits, whatever message you want to convey to the government, I'm here. So, and I am a true believer in international cooperation.
Thank you. Yeah.
I was just going to turn it over to you, Heitham, for some parting words. So thank you.
Well, don't leave, please. I'm going to get you. I have one question for each of you to finish it off. It's a fun one, so it's nothing tricky, but I just want to circle it back that thank you, Ambassador Marcela, thank you, Jerry, thank you, Art, thank you, Jorge, thank you for those who attended. I think that the pandemic is an obviously percolated to the forefront everyone's attention towards healthcare. We no longer go to New England Journal, we go to the New York Times now to get updates on what's happening in science or otherwise, for good or for bad, or whatever your favorite media is. But the point is that these topics all merge together: business, policy, social issues, and healthcare. We're all gonna get sick, we're all gonna be healthy, and they're all, and wish you all a long life, but they all intertwine, and thank you for sharing. We'll be having this type of healthcare diplomacy event routinely, probably every 2 to 3 months, and we aim to build sort of the audience, get those interested to come and participate, and we'll have a sort of a series of different important countries that relationships with the United States. Let's part, and I'm going to. I would like for each of you to come up with one word in your mind that describes the future of U.S.-Mexico relationships. It could be fun, it could be serious, but I guess, Jerry, I'm going to start with you because I know you could come off with a million things at the top of your head. We'll give the rest of the panel a few minutes to think about it, but go for it. Give us a word of the short term.
One word.
One word. It's got to be one word. That's the fun part. It's got to be one word.
Synthesis.
Excellent. Synthesis. Jorge?
Right. I do believe, and I will use 15 seconds. Ambassador, we will take you up on your invitation as Cedars-Sinai International, and we will definitely pick your brains and do something to help your Angelinos population and our Mexicans in Mexico, for sure. Thank you.
Ambassador, give us your word. It can be in Spanish if you want.
Pragmatism.
Pragmatism, that's a good one. From a pragmatic ambassador.
Forget about your ideologies, your beliefs. Let's be pragmatic. We have to solve.
Roll up our sleeves. Art, what's your word?
Creative. I think the next decade is going to present all kinds of opportunities for creativity and in lots of spaces and lots of verticals.
Awesome. Well, I'm not as smart as you guys. Mine is tasty, because every time I go there, I want to eat some good food, and Jorge's going to find the best.
Yeah, we're foodies as well.
So that's
He has to, full disclosure, he also likes tequila and mezcal.
Okay, guys, thank you all for attending. Thank you for
Happy holidays and keep safe.
Stay safe.
Thank
Be
you.
well. Thank you.